So in the last class we were discussing about Vrana and its Chikitsa, and today we will see about Sadhyavrana. So Sadhyavrana, it is told in Ashtanga that Sadhyavrana e Sahasa Sambhavati Abhigatata. That is the Vrana which is caused suddenly due to Abhigata or trauma. That is in Nija Vrana, due to Nidana, the dosha vitiation has to occur, which in turn need to vitiate the dhatu, leading to the formation of Vrana Shofa, which in turn gradually needs to separate, resulting in the formation of Vrana. That is in case of Nija Vrana, what is happening. Whereas in Sadhya Vrana, the formation of wound is immediate. That is the difference. In Nijavrana, there have to happen, means the Nidana have, means due to the Nidana, there should be dosha vitiation, then there should be dhatu vitiation, finally there should be a formation of Vrana Shofa, which in turn will gradually separate and result in formation of a Vrana. That is, whereas in case of Sadhya Vrana, the formation of the wound as such is immediate. That is told Sadhya Vranaye Sahasa Sambhavati Abhigadata, the Vrana which is caused suddenly due to Abhigada or trauma. And now the types we will see. Chinnam Bhinnam Tatha Vidham Kshatam Vichidam Evacha Krishtam Mahos Tatha Shashtam Tesham Vakshyami Lakshanam. So the types are told like it is 6 in number. They are Chinna, Bhinna, Krishna. Chinna is the incised wounds, Vidha punctured wounds, Kshata lacerated wounds, Vichida crushed wounds, and Krishta abrasions. Now we will see what the individual types is. First is Chinna, Tiraschina Rijurvapi, Yo Vranaschayeto Bhavet, Gatrasya Patanam Chapi, Chinnamityupadishyate. That is a wound which is causing part of the body from the rest of the body, that is called Chinna Vrana. It can be straight or curved. Tiraschina Rijurvapi, Yo Vranaschayeto Bhavet, Gatrasya Padana. There is a separation of the part from the rest of the body happening. That kind of wound is considered as excised wound or Chinna Vrana. Gatrasya Padana. Separation of a part from the rest of the body is happening in this type of wound. Next is Bhinna. Kunda Shakti Rishti Khadga Agra Vishanadhivirashaya Hatha Kinjit Sravetadhi Bhinna Lakshana Muchyate. Because of a trauma that can be due to sharp objects like spear, trident, knife, etc. When there is incision on a body part or viscera, resulting in exudation or discharge. Other kinchit sravetati, srava will be happening. Then it is called the bhinnavrana. That is incised wound. Due to a trauma caused by sharp objects, then will be an incision on a body part or viscera, which result in srava, exudation or discharge. That is called bhinna vrana or incised wound. तस्मिन् भिन्ने रक्तपूर्णे ज्वरोदाहश्च जायते मूत्रमार्गगुदासेभ्यो रक्तं घ्राणात् च गच्छति मूर्च्छाश्वासत्रिडात्मानम् अभक्तच्छन्द एव च विन्मूत्रवातसङ्गश्च स्वेदास्रावो अक्षिरक्तता लोहगन्धित्वमास्यस्य गात्रदौर्गन्ध्यमेव च हृत्शूलं पार्श्वयोश्चापि. That is, when the koshta is bhinna, what happens? That is, the koshta gets filled with blood, and that will result in fever, burning sensation, loss of consciousness, dyspnea, thirst, flatulence, loss of desire to eat. There will be retention of urine or obstruction to the urinary flow, flatters, feces, etc. Then redness of eyes, sensation of a metallic taste in the mouth, then foul smell of body or foul perspiration, then pain in the cardiac region or the flanks, and there will be bleeding from the urethra, anal canal, oral cavity, or nose. That is, finally, it will result in hematuria, melena, hematemesis, or epistaxis. That is what is happening when the koshta is bhinna. विशेषं च अत्र मे शृणु आमाशयस्ते रुधिरे रुधिरं छर्दयेत् पुनः आत्मानमतिमात्रं च शूलं च वृषभार्थं पक्वाशये गते चापि रुजो गौरवमेव च शीतता चाभ्यधुनादि खेप्यो रक्तस्य च आगम. And when it is amashayasta and pakvashayasta, when the blood is getting filled in the amashaya, what will be the uh, resulting presentation by the patient? That is, Rudhiram Chardayet Punaha, there will be hematemesis. Then Atmanam Adimatram cha Shulam cha Vrishadaranam, there will be extension, abdominal distension, and severe abdominal pain also will be manifested. That is in case of Amashayastha Rudira. Then it is told Pakvashaya Gate Chapi. When it is when the blood is getting filled in the Pakvashaya, what is happening? There will be pain in the abdomen, heaviness will be there, and Shitata, where the Shitata will be, coolness will be below the level of umbilicus, and Khebhyo rectusya cha agama. That is, Khebhyo means the openings or through the srotas related to the adobhaga, that is, through the urethra as well as through the anus, there will be bleeding. Melena or hematuria will be manifested. That is the lakshana when the uh, blood is getting pent up inside the ammashya as well as pakvashya. Next is vidha. सूक्ष्म अस्य शल्याभ्यर्थं यदङ्गं तु आशयात् विना उत्तुण्डितं निर्गतं वा तद्विद्धमिति न दिशेत्. When a foreign body having narrow, fine tip punctures the body other than the viscera, either it gets retained or it will fall off. Then the wound caused by that particular foreign body, that is called a vidhavrana. Sukshma asya shalyabhyadam yadangam tu ashyaat vina uttunditam nirgatam va tadviddhamiti nirdishyate. They are called vidhavrana or punctured wound. Next it is Kshata. Nati Chinnam Nati Bhinnam Ubhayo Lakshanantam Vishamam Ranamange Yatat Kshatam tu Abhinirtishet. That is the wound which neither looks like an incised wound, Nati Chinna, nor an excised wound, Nati Bhinna. Then Ubhayo Lakshananvidam, but it will be having mixed features of both. Vishamam Ranamange Yatat Kshatam tu Abhinirtishet. That is, it will be irregular in shape, and then it is defined as Kshata Vrana or lacerated wound. Next is Pichida. Prahara Pedanabhyam tu Yadangam Rudhadamvatam Sasti Tat Pichidam Vidyat Majarakta Paribhutam. So, because of the excessive compressing force, when the site becomes widened or when it is Rudhadam Gadam, that is when it's becoming swollen, damaging even the bone, that will cause finally it will cause the discharge of marrow mixed with blood. And that kind of vrana is defined as Pichita vrana, or we can call it as the crushed wounds. Next it is Krishta. Vigadatva yadangam hi sangharshad anyatha apiva ushasravanvitam tatu krishtamityupadeshyate. When due to rubbing or due to friction or any other cause, the skin gets peeled off from the underlying tissue, and it will result in burning sensation and discharge. Discharge can be blood or serous discharge, and such a kind of a wound is called Krishtavrana. We can take it as the abrasions. So these are the 6 types of Sadhyovrana tool. Once again, it is Chinna, Bhinna, Vidha, Kshata, Pichida, and Krishta. Chinna can be taken as excised wounds, Bhinna incised wounds, Vidha punctured wounds, Kshata lacerated wounds, Pichida crushed wounds, and Krishta abrasions. Now it is about the management of Sadhyovrana. First, it is told about the general management, considering all the 6, how the treatment can be decided. So first it is told Chinne Bhinne Tadha Vidhe Kshate Va Astrapati Sravet Raktakshaya Drujastatra Karoti Pavano Brisham Snehapanam Hitam Tata Tatseko Vihitastada Veshavare Sakrushare Susnigdhishchopanahanam Dhanya Svedascha Purvita Snigdhanyalepanancha Vatak Naushada Siddhescha Sneher Bastar Vidhiyate. So in Chinna Bhinna Vidha and Kshata, that these 4 kinds of vrana, there is excessive blood loss. Asrak Atisrave, there will be excessive blood loss, and that will cause aggravation of vata. So it is told that therefore such wounds should be managed by Snehapana, then Tatseko means Sneha Parisheka, Then Veshavare Sakrushare Susnigdheshchu Upanahana. Upanaha with the Snigdha Veshavara and Kushara. Then Dhanya Sweda, Snigdha Alepa, and Sneha Basti with the Vatahara Dravya Sneha. Vataknaushada Siddhaischa Sneher Vastar Vidhyate. So these kind of treatments can be used in the management of Chinna, Bhinna, Vidha and Kshatravrana, as there is excessive blood loss and finally it will be resulting in the activation of Vata. So that is told for Chinna, Bhinna, Vidha and Kshata. Next it is in the case of Pichita and Krishtavrana. Pichitecha Vikhrishtecha Nati Sravati Shonitam अगच्छति भृष्टं तस्मिन् दाहपाकश्च जायते तत्रोष्मणो निग्रहार्थं दधादाह प्रपाकयो शीतमालेपनं कार्यं परिषेकश्च शीतलः. So it is told in Vichitta and Krishtavrana, the blood loss is not that significant. Na atisravati shonita. There is no significant blood loss. But what is there? Instead of that, there will be more of daha, paka, etc. There is more of burning sensation and suppuration. So while deciding the treatment, it should be such that we have to avoid these kind of complications. So it is told Shita Malepanam Karyam Parishekascha Shitala. Shita Alepa and Shita Parisheka can be advised to avoid these complications, like to avoid the daha, paka, that ushma, what and all is caused due to that ushma. To relieve that ushma, we can go for Shita Alepa and Shita Parisheka in case of Pichita and Krishtavrana. Next, it is told in detail about all the vranas. So first it is Chinna Vrana Chikitsa. It is told ये व्रणा विवृता केचित् शिरपार्श्वावलम्बिना तां सीवेद्विधिनोक्तेन बध्नीयात् गाढमेव च. In detail it is told that is when the wound, when it is wide open and the tissue is getting separated, the tissue should be repositioned. Means when it is displaced or it is misplaced from its own normal anatomy, then first thing we have to do is reposition the particular part or particular tissues, and then we can go for suturing. It should be sutured correctly, and then Batniyat Gadhamevacha. And then bandage have to be done, and it is told it should be Gadabandha. Tight bandage have to be applied to arrest the hemorrhage as such. That is in general it is told. Yevrana Viprita Kejit Shira Parshvavalambina Tan Sivir Vithinuktena Batniyat Gadhamevacha. So first it is repositioning, then it is suturing, and then Gada Bandha it is told. Then separately each place it is told. Means when the Chinna Vrana is happening in different parts of the body, how the treatment have to be. First, it is told Karnam Sthana Tapahata. That is, it is told about the ear. That is when if ear has become Chinna, what have to be done? That is, the pinna should be ear pinna have to be repositioned first to its normal anatomy, and it should be sutured. And then it is told about the neck become Chinna. That is not completely, it is not excised, but there is Chinna Vrana in the neck. Then what have to be done? It is told see it is reposition, Samyak Niveshya have to be given, and Batniya, then bandaging should be done. Then after the bandaging, it is told Ajena Sarpisha Chevam Parishekam Tukare Uttanu Annam Samashniya Shayitacha Suyantrita. That is wound can be given parisheka with the ghee of God's milk, and the patient should be completely immobilized. That is, the patient should lie completely immobilized and sit up only for feeding purpose. So that is the treatment in case of the Chinna Vrana happening in the neck. Krikatikante, the term used is Krikatikante. That is, if the neck or the Krikatikanta, that region, neck region, if it is Chinna, too not completely, then what have to be done? Repositioning, suturing, bandaging, and parisheka with the Aja Sarpi, and then Uttana Shayana is told. Means it should be the patient should be completely immobilized, and only for feeding the patient can sit up. Then it is told about when the limbs are excised. Shakhasu Patitas Dedev. So when the limbs are excised, what happens? That is when joints, bones, muscles, etc. Means everything will be excised. All those layers will be affected. So the joints, bones, muscles, etc. are first repositioned in its normal anatomy. Then it should be sutured, and it is told it should be then covered by a spiral bandage. And then parishega have to be done with tailena parishejayet charmana gofana bantha karyo yuva hito bhavet. Then it should be rested in a sling, that is told by gofana bandha. So when the limbs are excised, then the joints, bones, muscles, etc. are first repositioned, and then suturing have to be done. Then it should be covered by a spiral bandage, and then parisheka have to be given with thaila. And finally, after all these kinds of procedures, it have to be rested in a sling, that is giving a gofana bandha. Then it is told prishte vrana yasya bhave uttanam shayid, that is when the tissue in the back is excised, when the vrana is happening in the back, after suturing the tissue, means after giving the suturing and bandaging, the patient should be made to lie in the supine position. When the vrana is in the back, then the patient is advised to lie in supine position. And when it is in the urasije shayet purusham vrane atu anyada, that is when the wound is happening in the chest region, he is made to lie in the prone position. That is the means after the suturing and bandaging, the position is told for prishta vrana as well as urasija vrana. That is the shloka. Then it is told chinnam nisheshata shakham, that is if the limb etc. has got completely excised, that is there is no chance of restoration of the normalcy of tissue, then what have to be done? Then it is told, then the stump, that is whatever part is remaining in means that is in contact with the rest of the body, whatever stump is remaining, the stump should be subjected to Agni Karma with the Ushna Taila, that is Snigdha Agni Karma is advised. And then it is told Kosha Bandha have to be applied, and other Shodhana Ropana Chikitsa, whatever is advised, that can be followed. That is told Chinnam Nisheshada Chakam Dagdva Tailena Buddhima Batniya Kosha Bandhena Praptam Karyam Cha Ropanam. So Dagdva Tailena, that is Snigdhagni Karma, we can take it like that. Then Bandhana with the Kosha Bandha, it is told. Then Praptam Karyam Cha Ropanam. Ropana, it is told. So whatever Shodhana and Ropana Chikitsa is to be done, that have to be advised. If the limb etc. has got completely excised with no chance of restoration of the normalcy of the tissue, then the stump should be subjected to Agni Karma with Ushna Taila, and then Kosha Bandha is applied, and other Shodhana and Ropana Chikitsa can be advised. For that, Shodhana Ropana and Taila, it is given, few preparations are given, like oil can be prepared with Chandana, Patnaga, Ludra, Utpala, Priyangu, etc. and that will be helping in the wound healing. That is about Chinna Vrana. So once again, it is told when the wound is wide open and the tissue is getting separated, the tissues should be repositioned first, and then suturing have to be done, and finally Garda Bandha have to be given. In ear, it is told the pinna have to be repositioned and suturing can be given. If neck is becoming chinna, then there repositioning is told, then Nirantara Simana is told, and bandaging is done. Then Parisheka with the Aja Sarpi is advised, and it is told like the patient should be immobilized and the patient can sit up only for feeding. Then it is told when the limbs are excised, the joints, bones, muscles, etc. are first repositioned in the normal anatomy, and then it should be resutured. Then it should be covered by a spiral bandage and parisheka with the thaila, and it should be rested in a sling, gofana bandha. Then it is told in case of Prishta Vrana, the patient have to be, after suturing and bandaging, patient is made to lie in supine position. And when it is an Urasija Vrana, it is like after suturing and bandaging, the patient can lie in the prone position. Then it is told like if the limb etc. has completely excised, that is there is no chance of restoration of the normalcy of tissue, then the stump should be given Snigdha Agni Karma. Using Ushna Taila, Snigdha Agni Karma can be done, and then Kosha Bandha is applied, and whatever Shodhana and Ropana Chikitsa is told earlier, that can be used. For Ropana etc., Taila prepared with the Chandana, Patmaka, Lodra etc. are advised. That will be best for wound healing. Next, it is about Bhinna Vrana. Bhinna Vrana, it is told when means that also when Bhinna Vrana is happening in different regions, it is being explained. First, it is told about the eyes. When the eyes have been pulled out of their sockets, then they need to be repositioned carefully without damaging the vessels and nerves by pressing with the palm. Then krita, whatever krita is suitable for netra, such kind of krita can be selected and that can be used for netra tarpana and nasya. So pidayet panina samyak patnapatrantareణ tu tatavasya tarpanam karyam nasyam cha anena sarpisha. So when the eyes have been pulled out, pulled out of their sockets, and first thing we have to reposition it carefully by pressing it with the palm without harming the vessels and nerves. It should means whatever procedure we are doing, that should not cause again harm to the structure as such. So without damaging the vessels and nerves, carefully the eyes have to be repositioned, and then it is told like netra tarpana and nasya can be done with the suitable krita. Then it is told when the abdomen udaran medaso vartar narkata yasya dehana, that is when the abdomen is incised and the subcutaneous fat is protruding out. Udaran medaso vartar nargata, in that condition what should be done? It should be sprinkled with the fine powder of kashaya rasa dravya, or should be excised with a sharp instrument. That is the instrument which is agni taptena shastrena, that is the instrument which is heated on fire. Such kind of instruments can be used and excision can be done, or else fine powder of kashaya rasa dravyas can be sprinkled over the injured region. And after the excision, we can use uh, honey, means krita, madhu can be applied externally, and we can do the bandaging. That is told in case of when the abdomen is incised and the subcutaneous fat, that medaso varti, that layer is getting protruded out. In that case, what have to be done? Then it is told once the eaten food has got digested, after the procedure, once the eaten food had got with the yashti, lakshana, gokshira, etc., mixed with the eranda. That is to really get relief from the pain and burning sensation. It is told like we can go for this kind of combination: krita or kshira mixed with the sharkara, yashti, laksha, and gokshira. That too added with the eranda. This will help in relieving the pain and burning sensation. That is told after the procedure. Then it is told it can be taken as the signs of internal hemorrhage. That is what kind, if these kind of symptoms are appearing or if these kind of signs are being observed, then we have to stop the procedure, or it is considered as a varjya condition. That is tatra antarlohidam pandu shitapadakarananam shitochvasam raktanetram anadhamsha vivarjayet. That is when in the patient these kinds of signs are developing, it is considered as varjya. That is antarlohidam pandu, pallor. Then shita pada karananam, cold and clammy limbs and face. Shita pada karananam, limbs and face will become cold and clammy. Then shitochvasam, cold breath. Rakta netram anadhamcha, reddish eyes, and anadha means distension, or there will be obstruction kind features will be present. When these kind of features are present in the patient, then it is considered as varjya. We can take it as the signs of internal hemorrhage. Tatra antarlohitam pandu shidavada karananam shidochvasam raktanetram anadhamcha vivarjayet. Then it is told about amashayastha rudira. When blood gets collected, what should be the treatment? Means when the blood is getting collected in the amashaya, what should have to be done? When it is collected in the pakvashaya, what have to be done? So it is told when the blood gets collected, there will be toxic features manifesting in the patient. To avoid this, we can go for vamana. when the blood is collected in the amashya, vamana is indicated, and pakvashayaste deyamcha virejana vasamshayam. When the blood is collected in the pakvashaya, virejana is indicated. Then other than that, it is told like asthavana vasti can be administered with drugs having ushna virya and shodhana property. And if excessive blood loss occurs, the patient is advised to drink blood. It is told pibedasrik. That is, if that much blood loss is there, then to compensate that blood loss, it is told like the patient have to be advised to drink blood. And it is told like swamarga pratipannastu yasya vinmutra maruta vyupadrava sabhinnepi koshte jivati manava. That is, in such condition, when the patient starts passing flatus, feces and urine through the normal passages and there is no signs of complications, then it have to be understood that the patient can be saved. That is, by continuous treatment or continuing the treatment whatever is appropriate to the patient, means we can assume that the patient can be saved. That is, when the patient starts passing flatus, feces and urine through the normal passage as well as there is no signs of complications, Vyupadrava, then we can consider that Jivati Manava. That is, even though there is Koshtabhinna happened, but still the patient can be saved if these kind of features are present in the patient. Then it is told like Abhinna Mantram Nishkranam. That is, when the Pakvashya is Bhinna. And then what have to be done? That is, when the abdomen is incised, the intestines inside is also getting damaged. What have to be done? First, it is told like if the intestines have not been damaged, that is, there is no direct injury to the even though the abdomen is incised, but still there is no direct damage to the intestine, then what can be done? It is told like any contaminations on the surface of the intestine that have to be cleaned. That is, the condition is like the abdomen is getting injured, it is being opened, but there is no injury to the intestine happened. That is the condition here. So what have to be done? Even though there is no injury to the intestine, but by the injury caused to the abdomen, there will be contamination happening on the surface of the intestine. So that have to be cleaned by washing with the kshira. It is told like kshira can be used for cleaning that area, and it is told we can smear krita over the area, and even though there is no injury, there can be a displaced intestine. There will be some repositioning needed to the intestine, and that have to be done. The intestines have to be repositioned correctly within the abdomen, and then it is told like the omentum, means omentum and peritoneum, is whatever kala is covering the intestine, that also have to be properly repositioned such that it is covering the intestine and it is again protecting the intestine, and then we can go for suturing the abdomen. That is, when the abdomen is incised but the intestines have not been damaged. In that case, it is told like all the contaminations can be washed out by using kshira, then krita can be smeared over the surface, and the intestines have to be repositioned correctly, and then it should be covered with its kala, whatever respective kala is there present, that have to be covering the intestine, and then only we can go for the suturing of abdomen. That is told if the abdomen is incised but intestines have not been damaged. Now it is told about if the abdomen is incised and the intestines are damaged, then what should be done? First, here it is told like the intestines should be cleaned with milk. Then it is told that the incision, that is the injury happened to the intestine where it has happened, that particular incision or wound, that have to be closed by the bite of herds of black ants. Black ants have to be made to bite over that wound region, and then the rest of the body, means body of the ant will be removed, so that the bitten heads will be remaining on the incised or the injured part, and that will keep the wound closed. So that is the, it is like Pipiliga shirograstam. That is, black ants are made to bite on the wound, and then the remaining part will be cut off, and that will keep the bitten ants will remain over the wounds, and that will keep the both the edges of the wounds to be opposed to each other, and that will help in the healing of that particular wound. So that is told for the incision. Then it is told after that krita can be smeared over the surface. Then repositioning should be done in the normal anatomy within the abdomen, and then abdomen can be sutured. That is told in case of uh, Koshtabinna, means abdomen is incised and the intestines are damaged. In that condition, this treatment is told. Cleansing with milk, then the wounds can be closed by using the Pipiliga Shirovrasta bite of the heads of black ants. Then krita can be smeared over the surface, repositioning have to be done, and finally suturing. It is told like when trying to reposition the intestines within the abdomen. That is uh, how to do the repositioning. It is told that is the physician will have to overcome the rigidity of the abdominal wall, means muscles. There will be rigidity experienced while doing the repositioning, and how to overcome that. It is told like the patient have to talk to the patient, relax him, divert his attention. It is told like we can tickle the patient's throat, or we can suddenly sprinkle cold water on the face of the patient, or it is told like to reposition the intestine as such. The patient can be lifted. That is, lift the patient by his hands and legs, and we can shake him so that the muscles will relax and the intestine will return into the abdominal cavity. While repositioning, normally there will be a rigidity of the abdominal muscles that will be experienced by the physician or the surgeon. So for overcoming this, few methods are told. Like the patient can the physician can talk to the patient to relax him, or he can divert the attention for that, tickling the patient's throat, suddenly sprinkling the cold water on face. These kind of things are told. Or else the patient have to be lifted by his hands and legs, and the patient have to be shaken, and by that method what happens, the muscles will relax and the intestine will return into the abdominal cavity. That is told for uh, making the repositioning easily. Then it is told when the abdominal wound is small, that is whatever injury have happened outside that is small, then what happens, it will not be that easy to replace the intestine. So it is told the surgeon should widen the wound for easy replacement of the intestine. Then the wound should be sutured. That is, while repositioning, that much care have to be given. Even though the wound is small, it is like we can extend the wound, and the proper repositioning have to be done. Then after that, together the wound have to be sutured. When the intestines are being replaced, they should be replaced in normal anatomy. Otherwise what happens, it can get twisted. That is what we consider the torsion, intersusception, volvulus. Such kind of complications can happen, and that will result in the death of the patient. So that's why the repositioning or that procedure is given so much importance there. Then it is told after suturing, the abdominal wound should be covered with a bandage dipped in krita. And for early recovery, that is, as told earlier, the early passage, means passage of flatus, etc., through the normal passage. For that early recovery, it is told warm krita, means koshna krita with little eranda thaila that can be given. And in addition to that, or whatever shodhana, vrana shodhana ropana measures have to be adopted, and whatever pathya is told for vrana as such, that can be given. That is told for uh, bhinna vrana in case of abdomen. So that is the treatment. Then it is told if the mushka is bhinna. Pado nirasta mushkasya. If the mushka is bhinna, that is if the patient is lost consciousness, then water should be sprinkled on his face, etc., and the patient have to be revived. The testicles which are out of the scrotum, that have to be carefully repositioned. Then the scrotum have to be sutured in tunna sevani type of sevana. Pravesha tunna sevanya mushko sevya tatapara. The tunna sevani type of sevana have to be done over the scrotum. Then it is told Karyu Gofanika Bandha Patyam Avesha Yanchakam. That is, the scrotum should be then bandaged with Gofanika Bandha. It is the T bandage. Here it is told Sneha are not used for the purpose of Ropana, because they can increase the moisture in the area, and thus the process of healing will be delayed. Na kuryat snehasekam cha tena klityari hi vrana. So it will cause more of Kledana at the region. So snehaseka is not advised in that particular case. Then it is told Shiraso apahrate shalye, means that is if Shiras is bhinna, what have to be done? It is told after examining the wound, all foreign bodies, dust, etc. have to be extracted out. Apahrite shalye. That is all the shalyas have to be removed from that particular site. Then to prevent the leakage of mastulanga, Balavartim Niveshe, Balavartya Madattaya Mastulungam Ranatstrave. That is to prevent the leakage of that Mastulanga, the matter from the cranial vault, whatever it is, that should not leak outside. To prevent that, it is told Balavarti, that is the injured site is plugged with a tuft of hairs. Balavarti have to be used. Then that will help in means Hanyadenam Tato Vayus Tasmadevam Vajre Pranairohati Chekegam Shaner Balam Apeksha. That is to prevent the death of the patient due to sudden aggravation of Vata and all. This can be helpful. So to prevent the leakage of Mastulunga, the injured site should be plugged with the tuft of hairs. That is the Balavarti. Then it is told means in after doing that we can go for the Ropana Kriyas. Whatever Ropana Kriyas were mentioned, that can be adopted, and slowly there will be a reduction in the wound size. As the wound reduces, the hairs from the tuft can be gradually removed. It is not all on a sudden. Gradually, it can be removed from the site. That is told for condition when the Shiras is bhinna. Next, it is Vidha Vrana Chikitsa tool. दूरवगाढ सूक्ष्मास्युर् ये व्रणास्तान् विशोणितान् कृत्वा सूक्ष्मेण नेत्रेण चक्रतैलेन कर्तयेत्. Wounds which are deep or with minute openings that have to be carefully checked for hemorrhage. Vishonitan, there is no hemorrhage, that should be carefully examined. And if hemorrhage is there, then whatever measures to arrest the hemorrhage that have to be firstly adopted. Then it is told that wounds, deep wounds or sukshma vranas, it can be irrigated. Then parisheka can be given or tarpana can be given using chakra taila. And another taila it is told, taila prepared with the samanga, rajani, padma, tuttha, vidanga, etc. That also help in the easy healing. So that is the treatment given for Vidhavrana. When the wounds which are deep or with minute openings are present, that have to be carefully checked for hemorrhage. And if hemorrhage is there, then hemostatic measures, whatever have to be done, that have to be given first. And then the deep wounds have to be irrigated with the chakra taila. And a few other taila preparations are also told, like using samanga, rajani, padma, etc. Taila can be prepared, and that will help in easy wound healing. Next, it is told about the management of Kshatravrana, Pichhidavrana, and Krishtavrana. Together, it is told. First, it is about the Kshatravrana Chikitsa, Kshate, Kshata Vidikarya. It is based on the features. Appropriate treatment measures have to be adopted in case of Kshatravrana. Then, Pichhide Bhaknavad Vidhi. That is, whatever Bhakna Chikitsa is told. Means in Pichhidavrana, when we have seen about the Lakshana, means what is Pichhidavrana, we have understood that there is involvement of the Majja as well as the Asti. So it is told whatever treatment is told for Bhakna, the same can be given for Pichhidavrana. Krishte Rujo Nigrahayashu Churne Rupachare Pranam. And in case of Krishtavrana, it is told pain relieving measures have to be adopted, and appropriate Avachurnana drugs can be used over the Vrana in case of Krishtavrana. That is the management of 6 kinds of Vrana tool. Now there is a mentioning about Taila Droni. It is told patients with the dislocations. Vishrishta deham patidam adhidam hatamevacha vasaye Taila purnaya dronyam sarasashanam ayameva vidhikarya kshine varmahate taga. That is patients with dislocations who have fallen from height or who have crushed injuries, etc. They have to be made to lie in a droni filled with taila. It's told like this prevents aggravation of vata. It will help to heal the wound, and also it will improve the strength of the person as such. During the stay in Dhoni, the patient should be kept on a diet of Mamsarasa, and it is told that this method can be adopted in Kshina and Marmahata Rogi as well. Then Parisheka with the Ushnakrita Bala Taila also can be used. That will reduce pain in the Sadhyavrana. And when a joint is injured, then it is told the joint have to be immobilized. Then and the patient have to be kept in a dhoni filled with the Koshna Taila, and other Ropana measures can be appropriately adopted. These are the treatment told for Vrana as such, and special reference regarding Tailadroni is also given in case of these conditions. Then it is about the Dushtavrana Chikitsa. Dushtavrana Chikitsa, it is told Dushtavraneshu Kartavyam Murtham cha Atascha Shodhanam Vishoshanam Dadhahara Shomitasya cha Mokshanam Kashayam Rajavrikshado Surasado cha Dhavanam Tayoreva Kashayena Tailam Shodhana Mishyate Kshara Kalpena Va Tailam Kshara Dravyeshu Savitam. So, Dushtapraneshu Kartavyam, Urdham cha Adashta Shodhana. Shodhana Chikitsa have to be done. That can be Urdha Shodhana or Adha Shodhana, Vamana or Virejana. Then, Vishoshanam Tadahara, Shonitasya cha Mokshanam, Apatarpana can be given. Then, Ahara, more of Katutikta Kashaya, Ushna Snigdha Ahara can be given. Then, Rakta Mokshana is told. Kashayam Rajavrikshado Surasado cha Dhavana. Prana Shodhana is told then. That is using the Kashaya of Aragvodadi and Surasadi Ganadravya. Pranashodhana can be done. Then Taila prepared with Aragvodadi and Surasadi Ganadravya. Pranashodhana can be done. Then Kshara Jala is also advised. Tayoreva Kashayana Tailam Shodhana Mikshade. Kshara Kalpena Vatailam Kshara Draveshu Sattvam. Kshara Jala is indicated for Pranashodhana. Then Kshara can be prepared using Apamarga, Palasha, etc. And that can be used for Taila. And that preparation also help in treating the Dushtavrana. And and when we consider other Shashti Upakrama, whatever is beneficial or according to the features present in the Dushtavrana, the appropriate Shashti Upakrama also can be adopted. And about wound as such, wound is a break or discontinuity in the surface epithelium. It can be simple wound or complex wound. When the skin only is involved, then it is called simple wound. And when it involves the underlying nerves, vessels, tendons, etc., then it is called complex wound. And the types of wounds, it can be closed wounds and open wounds. In closed wounds comes the contusion, abrasion, hematoma, etc. Contusion, the discoloration of skin due to collection of blood underneath. It can be a minor soft tissue injury without discontinuity of the skin, or major, such as when run over by a vehicle. Then abrasion, epidermis of the skin gets scraped off, exposing the underlying dermis, and there the dermal nerves also get exposed, and hence it is painful. Abrasion. Then it is about hematoma. It is the collection of blood following injury. Can occur spontaneously in people who have bleeding tendencies. It can be subcutaneous, intramuscular, or subperitoneal. Next, it is about the open wounds. In the open wounds comes incised wounds, lacerated wounds, penetrating wounds, and crushed wounds. Incised wounds, it is caused by sharp objects like knife, blade, etc. The wound will be having a sharp edge. It will be less contaminated. It can be treated by suturing. Lacerated wounds, it is caused due to blunt injury such as RTA. The edges will be jagged. Commonly, the skin and subcutaneous tissue will be involved, but sometimes deeper tissues may also be involved. It can be treated by wound excision and primary suturing. If it is treated within 6 hours, wound excision and primary suturing will help. Next, it is penetrating wounds, that is stab injuries of abdomen that are common. The wound may be small, but internal organs like intestines, liver, spleen, they can be damaged during a penetrating wound. So the patient should be admitted and observed for at least 24 hours, and then layer by layer exploration and repair is necessary in case of penetrating wounds. Crushed wounds or contused wounds, it can be caused due to blunt trauma like earthquakes, wall collapse, industrial accidents, etc. These wounds are dangerous as they may cause severe bleeding, death of the tissue, and crushing of blood vessels will occur in such kind of wounds. And in these patients, there can be a chance of developing gas, gangrene, tetanus, etc. So, while treating, it should be treated by adequate debridement and removal of all dead and necrosed tissue have to be done. That is the types based on the closed wounds and open wounds. Next, it is acute and chronic wounds. That is based on the duration. Acute wounds, in that comes the stab wounds following RTA, blast injuries, etc. Chronic wounds, the ulcers of lower limb, pressure sores, etc. comes under the chronic wounds. Then another classification is based on the contamination, tidy and untidy wounds. Tidy wounds, in that include the incised clean health tissue will be there. It will not be associated with much of tissue loss. Untidy wounds means it will be crushed, it will be contaminated, and so much of tissue loss will be there, and there will be presence of devitalized tissue also. So that is the another classification, tidy and untidy wounds. So wound can be classified in all these kind of ways. So that is about Vrana and its Chikitsa. So that is about Sadhya Vrana and its Chikitsa, and the modern about the wounds. Next topic is regarding the diseases of rectum and anal canal. So before moving on to the diseases of rectum and anal canal, first we will see about the anatomy. So rectum, it is the distal portion of the large gut. It is placed between the sigmoid colon above and the anal canal below. When we see about the vertebral column, it is in front of the last three pieces of sacrum and the coccyx. The upper third of rectum is covered by peritoneum on front and sides. Mid third, it is only on the front. Then the rectum has got three lateral flexions, left, right, and left from below upwards. Then the blood supply, it is from superior and middle rectal arteries and the median sacral artery. Then lymphatic drainage into the inferior mesenteric nodes and internal iliac nodes. Nerve supply, both autonomic, means sympathetic and parasympathetic. That is about rectum. And anal canal, it is 4 centimeter long, extends from the levator ani muscle to the anal verge. The dentate line represents the former site of the embryonic anal membrane, and the lining of the canal above this line is columnar epithelium, and below is the skin. The mucosa above this line has an autonomic nerve supply, and below is by pudendal nerve. Venous drainage, above the line is by inferior mesenteric and portal circulation, and below systemic venous circulation. Internal hemorrhoids develop above this line. And sphincters of anal canal, two sphincters are there, internal sphincter and external sphincter. First we will see about the congenital disorders, and first one is post-anal dermoid cyst, or it is a dermoid cyst which is situated behind the anal canal and rectum and in front of the coccyx and sacrum. It is a soft anal cystic swelling. It can be presented in the adult life also when the cyst becomes infected and with the formation of sinus in the exterior. Then it will present as a difficulty in defecation. Rectal examination is very important to diagnose the condition, and the treatment is complete excision of the cyst along with the sinus. Another condition is the sacrococcygeal teratoma. That is a teratoma at the sacrococcygeal region. It is the most common tumor seen in the neonatal baby. Sacrococcygeal region is the site of the primitive node. That is a group of totipotent cells which have the potential to form various types of cells that is present at that region, and that is why teratoma is seen in the sacrococcygeal region. It is the site of the primitive knot. A group of totipotent cells are present there, which can form various types of cells. The tumor is actually situated between the rectum and the sacrum, and it is firmly attached to the coccyx, especially to the last piece. Means, mainly it is to the coccyx, and occasionally it can be attached to the last piece of sacrum also. It usually presents as a big swelling, and sometimes it can contain the rudimentary limbs also, like hands or feet will be presented along with that particular swelling. It may become malignant. It has the potential to turn into malignancy. And the treatment told us excision of the tumor as the suggested treatment. That is, incision can longitudinal incision will be done, then the skin and subcutaneous tissue will be lifted. The whole of the tumor will be separated from the surrounding structures, the coccyx and the part of sacra where the tumor is getting attached, that also have to be removed. And if there is any fistulous connection, that should be excised, and the opening in the rectum, that have to be carefully closed. And after excision, the proper drainage have to be done, and then skin is closed and pressure bandages applied. So sacrococcygeal teratoma, it is the common tumor in neonatal baby. It is a teratoma at the sacrococcygeal region, and sacrococcygeal region is considered as the site of primitive knot, a group of totipotent cells which possess the potential to form various types of cells that is present there, and that is the reason why teratoma is seen at this region. And the tumor, it presents as a big swelling. It is situated between the rectum and sacrum. It is firmly attached to the coccyx usually, and occasionally to the last piece of sacrum. Treatment told us excision of the tumor. Next is imperforate anus. That is, it is a congenital normality in which the fusion, that is, there is an imperfect fusion between the hindgut and the proctodeum. That is the part which forms the lower part of the anal canal. So between the hindgut and proctodeum, the fusion is getting imperfect. Such a congenital abnormality is called as imperforate anus. And based on the anomaly, it can be low anomaly and high anomaly, and depending on how it is getting terminated, means on whether the termination of bowel is below or above the pelvic floor, it is divided into that imperforate anus. That particular anomaly is divided into low anomaly and high anomaly. In the low anomaly, again, another condition, means few conditions are told, like membranous stenosis, covered anus, stenosed anus or anal stenosis, ectopic anus, anal agenesis, etc. That comes under the low anomalies. That is, when the termination of bowel is below the pelvic floor, then it is considered as low anomaly. And when the termination of bowel is above the pelvic floor, it is called high anomaly. So the low anomalies include membranous stenosis, covered anus, stenosed anus, ectopic anus, anal agenesis, etc. And here the anal stenosis, it is told the whole of the anal canal is narrow, and or the anus will be microscopic with a minute opening. That will be the condition of anal stenosis. And the patient will presence like passing of meconium will be happening, but with great pain. That will be the presentation. And the treatment tool for anal stenosis is regular dilatation of anus. So that is anal stenosis. The whole of anal canal will be narrow, or the anus will be microscopic with a minute opening. The patient will present with passing of meconium with pain, and the treatment told is regular dilatation of anus. Another condition is anorectal agenesis. That is, a blind rectal pouch lies just above the pelvic floor. In the male, the fusion is attached to the bladder, and often there is a fistula between the rectum and bladder known as rectovesic fistula. And in females, there will be a fistula present at the posterior fornix. That is anorectal agenesis. This condition will come in the high anomaly. When we see about the imperforate anus, we have told about the high anomalies, that is the rectum ends above the pelvic floor, and there is often a fistulous connection between the blind rectal stump and bladder in case of males, or in vagina in case of females. That is the high anomalies. In that comes this anorectal agenesis. That is the commoner malformation. The rectum ends above the pelvic floor, and it will be connected with the bladder or with the posterior fornix of vagina through a fistulous communication. The anal canal will not be developed as such. In all these cases, the main clinical feature will be failure of passage of meconium, and on examination, there is no proper anal canal in the anorectal agenesis. And when we examine properly, there will be a spake of meconium that will be present in the penis or in the vulva. Because of that fistulous communication, the meconium will be present in the spake of meconium will be seen in the penis or in the vulva. Investigation, it is told like X-ray examination that will help to know whether the anomaly is of high variety or low variety. For that, X-ray examination will help. So these are the congenital anomalies of rectum and anal canal. Now next is about the prolapse of rectum. That is, what is prolapse of rectum? If we see, it is the circumferential descent of rectum or the bowel through the